Welcome to another session for AIMRRA for TRC. So our sample records was created for education and training purposes only. There is no real data in it. So my name is Dr. Lynette Woods. I will be touching on some key components of TRC, a lot of the questions that I always get. So let's dive into it. So today, our information is going to be coming from NCQA, Transition of Care public website. And this is their URL. So we're going to go right to it. Let me just share my screen. So what is transition of care? We know that it is a HEDIS measure. So it's about maybe 5 to 6 years young, maybe going on the seventh year. It's still very young. I remember when it first was rolled out, I mean, it was just a lot. A lot of people say it's still a lot. It's a lot of people say it is a complex measure, which I can definitely understand why they state that. But let's look at what they want, what is they requiring of us. Now, we're not going to go look at the four indicators. Today, we're going to talk about the shared versus non-shared EMR systems. All right. So, and I'll tell you what we're going to be discussing a little bit more today. So, but first, let's look at transition of care. So if you go to the URL, this is public information. The percentage of discharges for persons 18 years of age and older who had each of the following. So these four rates are reported. Now, this is one measure, transition of care. Underneath this one measure, we have four indicators or four rates that has to be reported. We have notification of inpatient admission, receipt of discharge information, patient engagement after inpatient discharge, and medication reconciliation post-discharge. And yes, I'm going to repeat myself. This is one measure, and these are four indicators within this measure. That's why some people identify this as a complex measure. So in other training sessions, I will go over how to abstract these four indicators from the medical record. So I'm going to have some sample medical records and I will go over that. In today's lesson, we're going to go over the shared EMR. Okay. How to identify a shared EMR. Shared EMR versus non-shared EMR. Okay. Now, let's look at the difference. We know that a medical record is a legal document or documents, right? So, in a medical record, it has to be stored somewhere. It could be paper. It could be a paper medical record. I mean, some states still do that. It's supposed to be EMR, but some still have a paper records. Then we have an EMR or EHR. EMR stands for electronic medical record, and EHR stands for electronic healthcare record. All right. So when a patient goes and see a provider, clinician, that provider has to document that visit. Okay. That visit now, that documentation in that visit now becomes a medical record, a legal medical record. All right. They can store it on electronic medical record. All right. We got that. We understand that. So let's look at the definition and we're going to go right back to that scenario. So a shared electronic medical record, EMR, or electronic healthcare record, EHR, can only be used by providers that are in the same healthcare system, not necessarily in the same health insurance plan. However, shared electronic records are different from non-shared electronic records. Only providers that are in the same healthcare system have access to patients' medical records via a shared electronic record system. Okay, so let me just get my pen. I'm going to make this more practical because it sounds good but it's a little bit, just a tad bit harder to understand. So let me write it down. So we have scenario one. We have doctors A, B, and C. Okay. And they all work in the same clinic. They all have access to electronic medical record. Okay. They all have access to the electronic medical record. Let's call this the internal electronic medical record. Okay. So they work for an outpatient clinic. Everyone understands that. We have three doctors here, Dr. A, Dr. B, and Dr. C. They all work in the clinic, in the outpatient. They all document, they review the medical records, they review the medications in electronic medical record. Okay. But here we have, for the second scenario, we have doctors D, C, well, D, E, and F. Okay. Some of them work in a clinic, and some of them work in a hospital. So now we have outpatient records from the clinic, and then we have inpatient records. Okay. We have inpatient records. So we have two different types of setting records. We have an outpatient setting records and we have inpatient setting records. Or we have outpatient notes or inpatient notes. Or we have outpatient pages and inpatient pages in the same in the same EMR. Okay. This is called a shared EMR. Shared EMR. Okay. Now, the first scenario here, this is an internal EMR. Even though all of their providers will have access to the EMR system, and all of their providers, they can have 20 providers, they can have 50 providers, they can even have 100 multiple providers, but that is their internal EMR system. Okay. That means nobody else, no other providers, no other clinics that does not work in that clinic will have access to that EMR system, hence internal EMR system. However, for a shared EMR, if they're in the same healthcare system, we have outpatient providers and inpatient providers, inpatient and hospital, outpatient and clinic, and urgent care, right? They all have access to the EMR, to the shared EMR. All right. Why? Because it's a shared EMR. All right. So let me show you this in a sample medical record. Give you some time to process that while I bring up my sample medical record. And if you don't know the difference or need a refresher on the different types of outpatient settings and inpatient settings, acute inpatient settings, definitely let me know. Send me an email or put it in the comments, and I would love to have another session on that. All right, so now we're looking at a sample medical record. So here we have 16 pages. We have 16 pages right here. We're still talking about transition of care. Why are we talking about transition of care? Because that's what, what I'm teaching on. But why is it important to have the shared EMR, to know the difference between shared EMR and a non-shared EMR for TRC? The difference is because TRC, all of these indicators have to be from an outpatient record. Okay. And if it's a shared record, then we need to be able to provide evidence that it's a shared EMR. Okay. We can't just say, well, it's a shared record and we can take outpatient pages, or inpatient pages without no outpatient pages in it. Okay. So we need to ensure that it is a shared EMR, a true shared EMR, right? So let me ask you a question. If we only have outpatient pages in the medical record, is that a shared EMR? If we only have outpatient pages in the medical record, is that a shared EMR? No, it's not a shared EMR. We can say it's an internal EMR. If it's clinic's EMR or a staff EMR, or the staff at that organization has access to that EMR system. Okay. But now for a shared EMR, just to recap, you will have outpatient providers and inpatient providers that will have access to the same shared EMR. So let's look at the sample record. We have 16 pages. And remember, for TRC, we would need to abstract all four indicators, all four rates. All right. So we're just looking at this record to identify, is this a shared EMR or a non-shared EMR? So right now, we're just going to be looking at the providers. All right. We know we have to all be within the same date of service, or a measurement year, I should say. All this should be in the same measurement year. All right. So what type of provider is this? I'm going to get my text box out for this. So page 1, we have an ER visit. Is this an inpatient page or an outpatient page? Now, I'm going to recap again. I'm going to say something a little bit different, but the same so everyone can understand. All of these 16 pages is considered a medical record. Okay? But each page we need to know, or each date of service, we need to know, is it an inpatient or an outpatient page? That's what we're looking for. So here, we're looking at page 1. We got Bobby George Small. We have Dr. James, and it says an ER visit. Now, is an ER visit a inpatient or outpatient setting? Inpatient or outpatient setting? So we know that an ER visit is an outpatient setting as long as the patient does not get admitted. Remember that. An ER visit is an outpatient setting as long as the patient does not get admitted, does not become an inpatient. All right, so let's look at page 1. Is page 1 an inpatient or outpatient? Okay, so we have here reason for consultation, patient is a 35-year-old female admitted for evaluation. Okay, we have admitted for evaluation. Let me just highlight that. So what does that mean? Is this page just date of service? So this date of service can have one page or two pages. So let's look at this date of service. This date of service have a page and a half. So this is a what? Yeah, date of service, July 12th. Is an inpatient. It's an inpatient. Why is it inpatient? Even though they went to the ER, but they got admitted. So that ER visit, it's an admission visit. Okay, perfect. Let's go down to page 2, or the date of service, a different date of service. All right, we have 5/4/2025. Okay, I got Dr. Gabriel, physician, admission, discharge, admit, discharge. We have an admit, discharge. This is a discharge summary. So is this, let's look how many pages. Because I just don't want to confuse you by saying page 1, page 2. We're really going by the date of service, but I'm trying to make it easier for us to follow the record. So let's look how many pages this discharge summary we have. Okay, so this discharge summary has, discharge summaries usually have a lot of pages, have about almost 5 pages. All right. So we know that this date of service, which is on 5/4, encounter date. So is this inpatient or outpatient? Right. So we got 5/4/2025. We have this as another inpatient. So far, the record is looking like what, guys? An inpatient record. So far. And if we had to stop here, this record will be non-compliant because it has no outpatient pages. If we stopped here, if let's say there was only 7 pages in the medical record or 2 pages in the medical record, this record would not fall within the criteria for TRC. But let's continue on reading. Okay, because we need an outpatient page. All right, we continue on. This is all in the same date of service. So we need another date of service, which we have it. We have 5/10/2025. Okay, and is this a inpatient or outpatient? All right, so we have Patel, cardiology, telephone encounter. Body states the medication was recommended by Dr. Lucas, states she does not want to take it, electronic lines. So is this an inpatient or outpatient? Right, an outpatient. 5/10 is an outpatient. So we have inpatient and outpatient pages. What does that mean for this record? Yes, that means this is a shared EMR record. Right, perfect. How do we know that this encounter note on 5/10/2025 that is an outpatient? Because we can't, the hospital only does with emergency, urgency. All right. We can't call up the hospital and say, hey, if as long as the hospital don't have a pharmacy, an outpatient pharmacy, a pharmacy that's connected to it, that outpatient can receive medications, not inpatient. There's a difference. I don't want to say hospitals don't have a pharmacy when they do for an inpatient. right? So, but this patient, this member called and got their prescriptions uh, uh, audit and talked to the nurse, okay, and they recommended more medication and to continue taking. So, this is an outpatient. So far, my question to you: Does this record is does this record consider to be a non-shared EMR or a shared EMR? Yes, this record is a shared EMR. How do we know? We have inpatient records and we have outpatient records. Yes, perfect. Okay, and that's one of the easiest ones to identify. That's one of the easiest ones. That's nice and clean and cut, right? And I know I hear somebody saying, just continue reviewing the record. What's the other 16 pages say? Or the other 9 pages say? I want to continue on reviewing the record. All right. But we don't have enough time to do that. So let's look at if we did not have, I don't want to say if we did not have, I would like to say if we needed more confidence. I don't want to say proof because this alone will meet the satisfaction criteria for TRC according to HEDIS, according to NCQA. If we have evidence of inpatient and outpatient pages in the medical record, that suffice. You don't need anything else. But some HEDIS reviewers, they like to see or like to have more information or more confidence. That's why I say confidence. So you have some shared EMRs that will identify shared EMR. They will identify this is a shared EMR. Does that suffice? Yeah, some organizations love that. Yep, it's a shared EMR. We have it right here. Me, personally, I always like to look for inpatient and outpatient pages. I just like to look. That's just best practices. Now, let's just say you did not have, and I can go on, I can talk about shared EMR for days. Let's just say you did not have the shared EMR statement at the end. And you wanted to make sure that it's a shared EMR, even though you see outpatient pages and inpatient pages. So let's say you didn't have that. You need to ensure that the medical record pages has the same flow and the same consistency. And dare I say the same font? I'll say similar font. Okay? What do I mean by this? I know, I feel like someone is like, okay, I'm just, I don't want to listen no more. uh, so let me ask you this question. Let's just say you're reviewing this medical record. And while you're reviewing the medical record, you see that a page was faxed in from the hospital. Okay. Just page, the second page or third page, whatever page, it was faxing from the hospital. Can you identify that that's a shared EMR? No, you can't. Would it, why? Because does the hospital or fax over discharge summaries, information, lab results? They may fax it over to the PCP. They may fax it over to the outpatient provider. And that's great. All right, that's wonderful. The only thing is, we can't deem that record a shared EMR because it's not shared. That hospital doesn't have access to that outpatient provider EMR system. They faxed it over. Could have been mail, could have been anything. That's great. That's good. The only thing is, some of the criteria and compliance for TRC wouldn't fit. Like, for instance, if we have a shared EMR, if it's an electronic health record field, then we don't need a receive date. Then we can go by the date in basket. So if we use that logic, that means we would have to know if it's a true shared EMR. If it's just an outpatient record, that will be great, but then we still have to find the receive date, the date of notification. All right, so that makes the difference. There is so much more that I can go over with shared EMR, but for the purposes of this training and the length, I want to cut it short there. But if you ever want to reach out to me, you can send a comment. I read the comment, and also you can email me at Lynette@AIMRRA.org. That's Lynette@AIMRRA.org. As always, it's been a pleasure to teach.